Aschoff bodies are nodules in the myocardium, pericardium and/or endocardium as a result of the pancarditis in rheumatic fever. Aschoff bodies are often perivascular and composed of a variety of cells including pleomorphic cells with abundant, slightly basophilic cytoplasm and basophilic nuclei with prominent nucleoli, and some of these are binucleate cells, and some cells have an owl-eye appearance. Other cells present include lymphocytes and plasma cells, occasionally eosinophil polymorphs maybe, and there may be an area of fibrinoid necrosis, and the inflammation will eventually result in fibrosis. Here is a low power view of an Aschoff body. You can see it's perivascular and it is at the center of the picture. Here is a higher power view of an Aschoff body. It is quite well circumscribed, and also you can see that it's just surrounded by a sprinkling of lymphocytes. The other thing that can be appreciated is the presence of large cells with pleomorphic hyperchromatic nuclei. Here is another higher power view of the Aschoff body. There are a number of these large cells that are binucleate with abundant cytoplasm that is slightly basophilic, and the nuclei contain prominent nucleoli, resulting in an owl-eye appearance. And scattered between these cells are lymphocytes.